All right, we are recording, we're live streaming the sports science conversation. I'm John Mercer, faculty in the Department of Kinesiology and Nutrition Sciences and co-director of the University Sport Innovation Initiative. And so the whole idea of this podcast, videocast, whatever we're calling it nowadays, I don't know, is to talk with people who have different connections to the sport science area. And so when I was thinking about different people here in town, Las Vegas, I thought of Donna. Donna Gould, how are you?
Thank you. Good. Thank you for having me. This
Well,
is
thanks for joining. This is going to be a lot of fun. And I thought of you because you came on our evidence-based triathlete podcast, little plug there, and you were talking about nutrition for endurance athletes, and that was really very helpful and really an important conversation because that's such a big topic. And so I thought of you, and I'm like, oh, I've got to have Donna on to talk about how she got to where she's at now and what she's doing, and because you've got a lot of great information and you had a really good path to get to where you're at now. So maybe just from a big picture perspective, I'll let you introduce what you're doing, and then let's talk a little bit about how you got to where you're at.
awesome. So, yes, hello. I'm Donna Gould. I am a registered dietitian. I'm also a recent UNLV graduate in the master's program in nutrition science. And although I'm a dietitian, I love physical activity and I love exercise. I grew up playing sports, watching sports. So I have this equal love of physical activity and nutrition. And I had to pick one, right? Like I can't become a dietitian and a physical therapist at once. So I picked one. I went with nutrition. But it was awesome that UNLV also has the kin department. So I got to combine my two interests and my two loves.
Mhm.
And so that's really, I think that's a nice introduction to kind of my interests, my what I'm doing. And I love talking about how I got here. So go ahead, ask
All
me some
right, so
questions.
yeah, let's dive into that. So you are a practicing clinical dietitian,
Yes,
and your specialty is in obesity, working with people with type 2 diabetes and people with heart disease.
yes,
And that's such an important area to do.
yes.
So what was your undergraduate degree in?
So my undergraduate degree is in nutrition sciences.
Uh-huh.
And in order to become a registered dietitian, you do need to get a clinical internship. So you go through the bachelor's of science, the 4 years, and then you apply to a clinical internship. And it's 9 months of a clinical experience in a hospital, also in the community, and also in food service. And it prepares us for our career in
Mhm.
dietetics. And so you apply to that internship, you get matched, and then you go through the internship. And then after that, once you complete the internship, you are allowed to sit for the board exam to become a registered dietitian. So you do need to take a board exam, just like nurses, doctors, other professional healthcare providers. And it's very challenging, as you would imagine. We study for it. I studied for about a month for it. Usually you study for about anywhere from 4 to 8 weeks. So I did my bachelor's of science. I did my clinical internship. I was lucky enough to be chosen by the VA hospital in North Las Vegas. And it was an absolutely amazing experience.
Mhm.
I know every internship is just really a great hands-on experience. But I got to work with such a special population. Really honored to work there. I got to do inpatient. I got to do outpatient. I got to work in weight management. I got to work in dialysis. I got to work in our diabetes. It was just, I got everything. And as a dietitian, I feel like it was such a great experience to be able to try all these different departments. Very similar to doctors, dietitians also have specialties. And you can be a general practitioner, but something that we learn in our undergrad is that there are all these different areas that you can practice. You can do gerontology, you could do sports nutrition, you can do community nutrition. And that's what's wonderful about UNLV's program is they have such a robust sports nutrition program. I digress a little bit. But anyway, so just like doctors, dietitians can also specialize. And I found out really early on in my educational career that I wanted to work in weight management.
Hmm.
What does that mean? That means I'm working with people who are trying to obviously manage their weight. Mostly these are people with obesity. And all I heard about through my undergrad and, just listening, obviously, if you're listening to the news and what's going on in the world, we have a very unhealthy population due to obesity. And obesity is also very strongly associated with type 2 diabetes and heart disease. Heart disease is the #1 leading cause of death. So it's like you start seeing all these problems in society and you're like, how can I fix this? Or how can I, try to work on this problem? And so during my undergrad, I got all these different, different experiences at the VA. And then I also did, oh boy, do you want me to get into what I've done also at my, keep going with my undergrad experience?
Yeah, no, I love this.
Okay.
I want to dive into a couple of things that you've said already,
Yeah,
but
go ahead.
Well, I imagine that working with this population of weight management, obesity, diabetes, and heart disease, it's on one hand got to be tough, but on the other hand, it's got to be sort of inspiring because they're probably really hanging on the knowledge that you have, and you're really impacting their lives.
Yes. Yes. A lot of these people are coming to me very, very desperate in very
Mhm.
desperate low situations. It's not obviously in today's world, it's not easy to talk about weight.
Mhm.
It's very, very difficult to talk about weight. And so, yes, I am meeting with people that are really at probably the lower end of emotions and how they're feeling. And yes, I get to work with them and I get to, be a motivator and almost like a cheerleader with them. And I call it a journey. I always say like we're gonna go on this journey together. And but yeah, it's very difficult, but it's also so rewarding. I cannot tell you how rewarding it is when people start getting those like aha moments and they start understanding how much nutrition plays a role in their health and
Mhm.
how much they can actually improve their health through nutrition and physical activity.
Mm.
So when you touch on that and you start, seeing that light bulb come off in their head and then they go home and they come back and see me in a month and they're like, "Oh, I started walking and
Yeah.
I started, not eating processed food as much." And you're like, "Oh my God, this is awesome." And it just shows that we all have the capacity to change and we all have this ability to inspire people to change, really.
Mm. Oh, I love that. I mean, and you're really helping them navigate a
Yes.
confusing nutrition world and exercise world because we're always battling what the advertisers and marketers are getting us to think and buy versus what we should be doing and some choices that may not be as popular in the marketing world, I guess. So,
Yes. Yeah. Like what social media is saying. Like I have some patients and clients that come in and like, well, TikTok told me this. And I'm like, oh no. Or I have the guy at the gym, the personal trainer at the gym told me to do this.
no.
And I honestly tell my patients, I say, listen, when it comes to nutrition, we all have to, remember who you're talking to.
Mhm.
The personal trainer at their gym might not have that credential. It might not have that understanding of nutrition, and a keto diet might not be the best thing for you. Whereas I'm not going to dispense exercise prescriptions, right? I'm going to talk about, what the guidelines are, ways to start getting moving. So it's important that we all stay within our scope. Obviously, there's some scope overlap, but yeah, I have to be really when during my assessment, I always ask like, where are you getting your nutrition information from?
Mhm.
What are your sources? And I
Mhm.
also provide, some more reliable sources that they can
Mhm.
look at. Absolutely.
I love that because and when you did your graduate work, I mean, there was a lot of research component to that. And what you're doing, it sounds like, is you're training people to critically evaluate the information that they're getting.
Yes.
And so you're
Yes.
not only giving them information, but you're training them how to get the information even without you there. That's got to be
Yes.
just a lot of fun being that impactful on lives.
Yes. It really is. It's awesome. It's a
So let's go back just a little further then. What got you interested in nutrition in the first place? I mean, coming out of high school and you have to major in pick a major in college. What drew you to, oh, I want to go in this nutrition path?
That's a great question. So I was always an athlete growing up. My main sport was track and field. I was a sprinter. And I always noticed, I don't know where I got it from. Well, maybe my family, we're all athletes, but I grasped on really early on, like as a teenager, that nutrition and performance had something to do with each other.
Mm-hmm.
And again, this is before internet. This is so, but I knew there was like this connection, even at this young age. I also watched all four of my grandparents die of heart disease, like major coronary artery disease.
Mm-hmm.
And so I was just like, wow, like this is just not, I don't really want this for myself. So I really started getting into nutrition at that time, like what was available. And, this is the late 90s. I don't mind aging myself.
Mm-hmm.
And just kind of figuring out like, what is it? And at this time, there was this big talk about like red meat and, wasn't good for you. And just personally, I decided at a very young age, I wasn't going to eat red meat. I wasn't going to eat pork. I told my parents at around 15, 16 years old, like what my new diet was.
Mm-hmm.
And I didn't realize it, but it was very similar to a Mediterranean diet. And so I started researching Mediterranean diets. And anyway, I just went down this huge rabbit hole of nutrition. Unfortunately, my parents didn't really we weren't a science family. So I got pushed into journalism actually. And which was, my parents were like, this is a great soft skill for you to know how to communicate. So I actually went to I got my first bachelor's in journalism.
Oh, I
So
knew that. That's
yeah,
awesome.
that was like a long time ago. I feel like it's like a different lifetime ago. So I have a bachelor's degree in journalism, but when I graduated, I started immediately working for an herbal supplement company and writing all their marketing content. So that's where I got into, so I started combining my love of writing and the nutrition, and that's when I actually went down the rabbit hole. And I started realizing that there was so much science behind nutrition that you cannot find anywhere. Yeah, there's all this science that unless you know where to look and you know what sources to look at, you're not going to find the information that is really needed for our health. So I just started going down this science path, and I was lucky enough that my local community college in LA had a bunch of prerequisite nutrition classes, and I went back to school to become a dietitian.
I
So
love it.
not too long after I finished my first degree.
Yeah, that is fantastic. Is that you're following your passion, you finding
Yes.
what you enjoy, and then I imagine at that point going to class and seeking out the education is not as painful, if you will, and it
No.
ends up coming a little bit easy at that point.
Oh yeah. And I tell students that I'm like, you're going to have some classes where they're not going to be your jam. It's okay. Like I had to take chemistry and organic chemistry. Those weren't my jam. But once you start getting into the classes that are your major, like those, even some of the 200 level classes, but really those 300, 400 level classes, it shouldn't even feel like class anymore. Like it shouldn't even feel like effort. It should just be like fun, and you should just be enjoying the information you're getting. And that's really how I felt, with my undergrad and especially my master's at UNLV, is that you start taking these classes, these 300-400 level classes, and it becomes like fun.
Mm-hmm.
And that's how you're in the right major.
Oh, that is spot on. That is such great advice. And I think the flip side is if you're taking those upper division classes and you don't like those classes and you're dreading going to them, it's the wrong area.
Right.
Check it off and say you don't go in that path. Go find something else.
Exactly. Don't do what I do. Like I knew journalism wasn't for me and I kept going. Like I wish I had someone to tell me like, stop, just cut it off.
Well, you're a good writer though, so
Thank
that
you.
did pay off. So
It did pay off, I guess.
right.
But yes.
So was there a particular course or series of courses that really sort of caught your eye and said, this is what, okay, this is where the path I want to go? Was that the
Yeah, so I definitely have my like prerequisite class and then my UNLV classes, but I say when I was doing my prereqs, that nutrition 101 class, you have to take like this nutrition science 101 class. And I would say that was probably one of the more influential classes that I took in my prereqs, because that was like really showing you that nutrition is a science.
Mhm.
Okay, it's not just we have to realize that nutrition is like it's fuel for our body,
Right.
right?
Mhm.
Once I got to UNLV, I think some of the most influential classes for me have been the KIN 350 class, that social psychology of physical activity. I thought that was a really awesome class because you can apply it to not just physical activity, but nutrition, physical therapy, anything you're doing to try to get people to make changes. So that was a great class that I still use. I use your class a lot, to be honest with you. I do. I took your master's, the KIN 657, because I have a lot of people in town. So that's the physiology of endurance performance. Because I have a lot of people in town and I work with people that are former athletes
Mhm.
and they are trying to get back into shape, or they're trying to get back into their endurance. And one of my projects I did in your class was how to train in the heat and
Mhm.
how to acclimate to heat and different weather. So I work a lot with my patients on not just how to get active, but how to exercise and perform in extreme
Mhm.
weather situations like we have in Vegas,
I
because that's a
love it. I
huge
love it.
barrier,
It's
huge barrier.
yeah, it is, and I love it when students can start matching up the information they're getting in class and applying it to real world, because that's where you really start really recognizing why we're learning something, or what's the important information to get out of that.
Ooh,
So
there's
yeah,
one more, the KIN 492 class,
yeah,
the
yeah,
clinical
clinical
exercise
experience. Yeah,
physiology. Oh my gosh.
yeah, yeah, yeah. I love it.
Yeah, I still have my notes from that
Yeah.
class. I use that with my patients and clients. Yeah. So
I took a similar class in my master's program, and in the same way, that was a class that was really impactful and really
yeah.
sort of gave some ideas in terms of why we need to know our physiology and how it can help people in the
Yes.
clinic. And heart disease is obviously a big area, so that's
Mhm.
pretty neat. All right, so let's switch gears a little bit. How did you go about finding a job after you were done? And I know
Great
you're
question.
doing the clinical dietitian work now, so how do you go about navigating the real world?
That's a great question. So I have always believed that an internship can always lead to like a full-time job.
Mhm.
So I've done that in my first career. I had an internship, and it led to a full-time job. So I looked at my internship as at the VA as a job interview. Like that full
Mhm.
9 months was a job interview. And that's, yeah. So I got hired after I finished my internship, took my exam. I recontacted the VA and told them that I'm now registered and they had a job opening. So they're like, of course, hire or apply. Because they already knew me, right? So I tell students, like, if you have an intern, like go back to the internship that you were at,
Oh, that-
contact the intern, the internship coordinator. So like that's how I got my job. I also know, because this is a relatively small town, relatively small, a lot of people, like all the dietitians in town really kind of know, not like they know each other.
yeah.
I can imagine it's very similar in the PT world, in the OT world, personal training. So I just also started talking when I left the VA, because I wanted to finish up my master's. I kind of just put the word out that I was looking for maybe some side work. And
Mhm.
it just so happened that I had a colleague at the VA whose doctor was looking for a dietitian at his practice. And so it was just networking at that
Mhm.
point. And that's how I feel like a lot of jobs are, really, is just, and that's how it was in my first career, is word of mouth, networking.
Mhm.
And I tell students, like, start in your undergrad, start networking in your undergrad. Um, you know, if you have a little time, try to get some experience working. That's another thing, is I was also working as an intern at the at Extension, the University of Nevada, Reno Extension. And that also led to a full-time job as well. So I think really utilizing like the intern route when you're in college, if you have some time as a bachelor's. I know people don't really want to get um, you know, they don't want to do anything for free, but there are a lot of internships that pay. And I think that's a great experience.
Mhm. I love it. I'm glad you mentioned both the paid internship and the free ones
Yes,
where you're not getting paid. And on one hand, sometimes like, oh, I want to get paid. But on the other hand, they don't, if you get paid, they sometimes treat you like an employee as opposed
right.
to getting just pure educational experience. If they're not paying you, a lot of times that sort of frees you up in terms of what you actually can do.
Exactly. And it might just be, maybe an hour or two of volunteering or of a internship, free internship experience. So
Well, I love that advice, and I like this networking type of information for people because it's not easy to look up these types of jobs in a
mm,
classified or
mm,
whatever job search engines because the names of the jobs are not consistent. And so having that network of people is important. And it starts really with your degree and then also
yes.
the experiences that you're having outside the
Yeah, and
university.
then also the different groups you go to, like it's really important to go to like different if you're, I'm a part of different organizations as a dietitian. Even when
Mm,
I was a student, I was a part of different student groups.
yeah,
I was a part of SNDA as a student. I know there's a kinesiology club, there's a
yeah,
pre-occupational therapy club. I would just encourage students to go to those as well because those clubs will be the first to get information about internships
yeah.
and
Oh, that's
experience.
great. Oh, I love that. And great networking tip. So now let me ask you a job question again. What
Yes.
does a typical day look like for you when you wake up and you go to work?
Yes.
What's your day look like?
So I have, just like you go to a doctor's office, I have my schedule of patients for the day. So I usually see about anywhere from 9 to 11 patients a day.
Mhm.
If they're new, I give them an hour meeting I do an hour consultation with them. And if they're follow-ups, I usually do 30 minutes. Um, I so I have all of my counseling sessions structured. I have my charting template. My doctor's old school, so everything's written. I would tell a lot of people, tell students that not everything will be like, electronic. You will have some people out there that are old school. So it's all written notes. I It's funny, it's interesting. My doctor is like, do you want to wear scrubs? Do you want to wear a coat? And I'm like, no, it's interesting. Like you have to almost like set your like how you want to present yourself, like as a dietitian. So I am always in business casual. I'm always in a blazer and jacket, very professional. Um, and I also bring handouts. I have my own I have all my own educational resources that I give. A lot of my patients get like this, almost like this like starter kit when they see me, because I'm dealing with a lot of the same patients, like types of illnesses. I can have a lot of the same, like I can just print out like the same handouts. So I have handouts that go over all of the different micronutrients, how to add protein to your diet, the different fats, why fiber is so important, heart health, how to eat for diabetes. I have a whole section on motivation and how to break habits. That's something I'm really big on, is behavior change. So, but that's a typical day. I'm back to back. It's like I got, like you would go to a doctor's office. I call my patients, they come into my room, I weigh them, and we have 30 to 60 minutes of an intervention, really.
Mhm. Mm. I love that. And I love this handout idea that because you never know when the learning opportunity is going to be there for
Yes.
you, helping someone and just having everything, prep for that it sounds like a great idea.
Yes, a lot of learning, a lot of teaching. I call it, it's education and counseling, because
Hmm.
you'd be surprised, like when do we ever learn about nutrition?
Yeah, right, right.
When?
Yeah,
So I have a lot of adults sitting in my office that don't even know what a carbohydrate is.
yeah, right. Hmm. Yeah,
So
no,
it's a lot of education, a lot of teaching, and a lot of motivation, behavior change.
so how do you stay current with information?
That's a great question. So I'm required to maintain my credential with continuing education units.
Hmm.
So I have to take different educational classes. I go to conferences. I actually have my major conference is actually next weekend, my major annual conference. It's called Fancy. It's in Denver this year. It's my first time going. So I'm going to be networking like I've never networked before.
Mhm.
But so that's about, so we have to do every 5 years, we have to do 75 units. And I like to, and you can pick and choose your areas, but I really like to stay current on weight management. There's a lot of interesting news coming out on weight loss medications. That's a hot one right now. A lot of the diabetes medications have been in the news right now. So I'm always trying to stay current, especially on a lot of the medical nutrition therapy that is associated with my field. Any, like, I always get, patients will tell me, hey, what do you think of this? And I'll say, I have to research that a little bit. So I get ideas from the news, I get ideas from my patients, I get ideas from what my academy is putting out. So I like to think I stay pretty on top of what's going on in my field.
The learning never stops,
It
and you're an
doesn't.
example of that. And
It
it's a
doesn't.
passion for you, and so it comes easy.
It does. It
Yeah.
does. So, and now I'm
Well,
teaching. So
I,
it's
I,
great.
I know that work like that can, really overwhelm you at times. So what do you do for fun outside of work?
Yes. So it's very tiring, as you can imagine, actively listening to about 9 to 11 people a day,
Mhm.
because I'm really listening. I have to listen to every single word these people are saying, and that's tiring. So I come home, and if it's football season and it's Monday, Thursday, Saturday, or Sunday, I'm watching football. I also I love running. I love walking. So I that's a part of my life as well. I love going to concerts. I think that's really important, is like different arts. The Smith Center is awesome. I go to the Smith Center a lot, and Myron's, to be honest with
Mhm.
you. Um, I just really, I think it's very, very important to have good work-life balance.
Mhm. Yeah.
Very important.
Mhm.
So
Having that balance actually helps you with your passion of nutrition and wanting to learn more. But having things outside of work is really, that interest outside of work is really good. So this is great to hear.
yeah, it refreshes you. It keeps you fresh. And then,
Yeah.
on Monday when I'm back, or Tuesday when I'm back with my patients, or Monday
Yeah.
when I'm back with my students, like, I'm refreshed, I'm
Yeah.
energized. It's
Yeah.
like,
Oh, I love it. Donna, this has been so good. I
thank you.
really appreciate you coming on and having this sports science conversation. I think it's great insight for students, especially to really get a sense for how to enter an area like this. So this has been great.
Thank you. Thank you for having me.
Yeah. All right. Well, I told you I'd keep you for 15 to 30 minutes, and we're coming up on that 30-minute window. So you've been very generous with your time. I appreciate it.
Thank you.
Don't hang up. I'm going to go ahead and
Okay.
stop the live stream and the recording. And thanks everyone for listening.
Yeah, thank you.